ObamaCare. The public's view on Obamacare continues to be extremely split, right down the middle. It fluctuates a little bit, but basically half the people like it and half the people don't like it. That is not what, of course, President Obama and the Democrats were anticipating. They thought that this was going to be a runaway winner of a topic. What do you mean? Universal coverage? America, everybody, you ask people in America, do you believe in universal health insurance? And everybody says, yes. And then you ask them, would you be willing to pay more for universal health insurance? And everybody says, yes. And then you ask them, how much more would you be willing to pay for universal health insurance? And they say, $7.50. Right? And would you like the government to do that? No. Okay, so that's our dilemma. We use bumper stickers, keep the government's hands off of Medicare. Okay? That's a classic Americanism. Right? And off of my guns. Right? Okay, so it has not been a great winner. And it's still, and I think that the hope of the proponents is that as it sort of settles in, people will become used to it, and then they'll decide that they like it. And repealing portions of it will become less and less feasible. The most obvious was the very first thing that they implemented was a few very popular things like requiring employer health insurance to cover children up to the age of 26. Well, there's a bunch of people out there who have kids up in college who are now covered and who are like, wait a minute, I'm not, I like this. I like this. And they also have limits on underwriting by which insurers can have, in the past, they won't sell insurance to people who have pre-existing health conditions. Now they cannot do underwriting on children, and in the next year they won't be able to do it on adults either. Once people get used to that, they like it. They like it. So there's going to be a variety of things. On the other hand, also the things that the Americans don't like, apparently, is taxes, except for on rich people. And rich people, by the way, the definition of a rich person is somebody who earns more money than me. That's like the definition. Okay? So the most likely scenario is that people want all these new health, the rights, the benefits, and they want lower taxes. That's kind of like, In fact, that sort of sums up health policy right there. And that's the dilemma for the wonks have to kind of try to make that work. The politicians are going to stare you right in the eye and we say, we're going to give you all these new benefits and we're going to cut your taxes. And the federal budget deficit is going to go away. You know what I mean? And then boom, vote for me. And then they turn, and it's like all the policy wonks have to kind of make that work.